So here we are. It's the Ben and Gary Show. We know dentistry, and we have an awesome guest today. This is Dr. Justin Zalewsky, and he's a periodontist, and we worked along with him quite often. So it's a perfect time for us to be able to discuss this question that we got from an individual who wanted to know a little bit about what is LANAP, or laser-assisted new attachment procedure, and that's what it's better known as. And Dr. Zalewsky, being a periodontist and who actually works along with this latest technology about helping to be able to save your teeth, we're going to try to debunk and at least understand a little bit more about what that is. And at this point in time here, welcome to the show, Justin.
Thank you.
Always glad to have you here. We're actually, I think these guys are getting ready to go to the baseball game, which is, I'm just disappointed I'm not going to be rolling with them here. But hey, listen, I can't do everything. So they're going to have a great time. But in the meantime, we're going to answer this question before they shoot on off to the game. So, Justin, maybe you want to give us a little history or understanding of like what LANAP is and why would somebody want to use it?
Yeah, so LANAP is a technology. It's actually not a newer technology. It's been around for about 14, 15 years now, and actually the laser that we're using is still the same laser that was the original one that came out. What's great about it, though, is recently, about 3 years ago, LANAP got an FDA approval for true regeneration. So when we talk about regeneration...
Yeah, what does that mean?
So regeneration means you have to have new bone, new cementum, and a new PDL that forms. So it's one of the only products that's out there that actually has an FDA approval for true regeneration.
Wow.
And what we're trying to do is it's an alternative to traditional osseous periodontal resective surgery.
Right, so you make an incision.
You're cutting away. So the easiest way for me to describe it is, and when I do this for patients all the time, so if you look at it, you have your tooth, you have your root, you have your bone level, then the gums cover everything.
Right.
When we go around, we get 2s and 3s, that's healthy and normal. In perio disease, gum disease, the bone is, we lose bone, but the gums are still up high. So we have those deeper pockets that everything gets into that causes inflammation.
Right.
That inflammation leads to more bone destruction.
Gotcha.
Okay? So with osseous resective surgery, we numb it, we cut open the gums, clean everything out, and then suture the gums back lower. It makes the tooth longer.
Yeah, it makes the tooth longer, reduces the pocket.
You get rid of the pocket. Yep, it works, it's great. But you get that picket fence appearance where things, real long roots, everything's getting stuck.
Yeah, nobody wants to be long in the tooth.
No,
there's really
not at
something
all.
about that. Yeah.
So now with the laser, it's a regenerative procedure. So just how we're doing, it feels like a cleaning actually. So it's still true surgery, but we go through that pocket and we actually get the bone to grow back.
Wow.
So we get the bone to come back
without reducing the gum tissue.
Without cutting anything away or reducing it. So now we got the bone back, the gums back. It's really turning the clock back, going back in time to regrow it back. So we're taking old teeth and making them teenager teeth again.
Awesome, man.
So
that's incredible technology.
It's amazing technology. It's not a silver bullet, but it's an option for anybody, because here's the thing. If it doesn't work, like I said, it feels like you had a cleaning, and you can always do the other treatment.
Oh, right.
So once you do the more invasive procedure, you can't go backwards.
Right.
So this is a minimally invasive surgical procedure.
Yeah. Okay. So if I was referring a patient to you, do you prefer that we don't do the deep root planings and scalings and all that?
Correct.
Right?
If I can see the patient before the deep cleanings, when the tissue is a little more inflamed, we actually get a better result.
Okay.
Now, if you've done the deep cleaning, all we do is we just give it a little time. We might skip a hygiene appointment, or if you just did the scaling and they're due on a 3-month recall, then we see them 3 months. We don't go right into the surgery. We wait till they're due for that next appointment. So it's not that we're skipping or getting off cycle. We just wait till they built up some more plaque and bacteria again, then do the surgery.
So the inflammation, the advantage to having a little bit of inflammation is what then?
So the reason is it's specific for certain bacteria, and it works better. The body has more. It's that when that inflammatory process is already going on, then the laser interacts with it better and allows for a better healing process to occur.
That's amazing.
It is amazing. So it sounds like basically our patients here, the yuckier the better. Before you sum it.
It is, but we want some of that inflammation. But the great thing about it is it's awesome around teeth. It's even better around implants at times. So LAPIP is the alternative, which is laser-assisted implant procedure.
Right. Instead of teeth, on
Instead of
dental
teeth,
implants.
you can do it on dental implants.
Right. Okay.
So if nothing else, you're kicking the can down the road as opposed to telling a
Yeah.
patient, hey, we got to take this implant out. It was probably sold to you as it's an implant. It never needs a root canal, never
Right.
gets a filling,
Right.
and now there's a problem with it.
Right.
The patient has spent a lot of time and effort and money.
Yeah.
We give them an opportunity to try to save that implant longer.
Yeah, that's amazing. That's
Yeah.
a great
Advantage, yeah.
No,
benefit.
it has really changed the way I practice.
Mhm.
It's allowing me to treat a lot of patients that I never would have seen,
Right.
never would have gotten the opportunity to treat, and we're saving more teeth.
Yeah.
Not to mention, I would also think about it in terms of just being obviously a valued procedure. So if you're talking about natural teeth or implants that are ailing or failing, which
Yeah.
means that at that point in time you have to take them out, start over, or do a new implant.
Exactly.
Whereas this is something that's, I'm sure it's far more cost effective to be able to try and
Yeah.
save.
Oh, it's
and not have to
fractional.
redo.
It's
Yeah.
fractional. Yeah. No.
Amazing.
So I mean, it's one of those cases where technology has really helped us
Yeah.
along to treat patients and
Sure.
give them more opportunities.
So it seems like the good candidates are pretty much anybody who has periodontal disease,
Pretty much.
who has deep pockets, who wants
Yep.
to be able to try and get back to health and normalcy.
Yes.
Yeah.
Yep. The other great candidate, the people that we treat are medically compromised. No medication. No, they don't have to
Gotcha.
come off any medications.
Mhm.
They don't
Oh,
have to
wow.
adjust anything because there's really no bleeding with this.
Gotcha.
Nobody comes off of blood
Yeah.
thinners. I mean, it's just
What
it's
can a
opened up
patient
whole
really
world.
look to expect in terms of their daily routine
Yeah.
afterwards?
So after the diet's a little bit different.
Mhm.
They're on a liquid to softer diet for the first few days because we
Okay.
need the clot to form and mature. But then within 5-7 days, it's really normal surgical protocol or post-surgical
So
protocol.
patients are brushing, flossing normally, or
They're not brushing and flossing for the first 2 weeks, but they're using an antibacterial mouthwash that
Right.
kills everything
Mm-hmm.
to keep things healthy.
Okay.
And they're brushing the teeth. I don't want them on the gums. So we teach
okay.
them how to, change their brushing techniques at
Understand.
first so that they can
Yeah.
let that heal actually.
If somebody has a mechanical or electric toothbrush, do you tell them to get off of
We
that?
take them off of that.
Okay.
That ultrasonic vibration can
Yeah.
disturb the clot, so they're off of that for about 6 to 8 weeks.
Excellent.
Okay.
Excellent.
Yeah.
That's cool.
Cool. How about pain for them? Is there? What can they expect? I mean, that's always a big question for patients.
It really doesn't exist.
Wow.
Oh my
The
God.
the pain level is the injections.
Sign me up.
Outside of the injections, because you have to get numb,
Yeah.
there is like zero pain with this.
That's incredible.
Yeah.
I knew we had the right person here to
Yeah.
talk about this.
No,
And-
glad I could get some
Yeah,
information out
yeah.
there. So thank you for having me.
Yeah, well, we really have enjoyed Dr. Zalewsky's time here on the show, and we're glad that he's here to be able to answer the questions here. I really appreciate
Great.
it. Here,
Thank you.
So go Nats.
Yeah. Thank you.
Excellent.
Appreciate
You
it.
guys have a great time.
Thank you.
Okay.
We will.
And enjoy the rest of your weekend, folks.
Yep.
And we'll talk to you another time. This is the Ben and Gary Show. We know dentistry. Thanks
Great.
a lot.
Thank you.
Have a good one.